of you and welcome you all. I'm Dr. Reema, Chief Operating Officer and Group Medical Director with Kite Senior Care, Bangalore. We gather here today to discuss a few important points of one of the largest issues that we face, cancer. Cancer is a leading cause of death worldwide, accounting for nearly 10 million deaths in 2020 as per WHO. The incidence of cancer increases as the age increases, and incidence of cancer in people over 65 is 10 times greater than those in younger age group. The cancer death rate is 16 times greater in patients for over 65 years compared to the younger patients. There is no household where we would have heard that someone is suffering from cancer. May not be immediate family, but we do hear very frequently someone has been diagnosed with cancer, someone is undergoing treatment for cancer. The United Nations has marked 4th February every year as the World Cancer Day, where the entire world unites together to raise awareness of cancer and to encourage its prevention, detection, and treatment. World Cancer Day is led by the Union of International Cancer Control. The primary goal of this day is to significantly reduce prevalence of the disease, the death caused by cancer. World Cancer Day targets misinformation, raises awareness, and reduces stigma attached to cancer. Multiple initiatives are run on the World Cancer Day to show support for those affected by it. One of the examples being No Hair Selfie, a global movement where individuals have their heads shaved to show a symbol of support and courage to those undergoing cancer treatment. Today, we at Kite Senior Care are demonstrating our support for the patients and their families who are fighting cancer by organizing this session in collaboration with Site Care Hospital, Bangalore, a hospital pioneering in cancer care with experienced doctors and latest technology. I welcome Dr. Purnima, who is a surgeon with Site Care Hospital specialized in gastrointestinal surgery cancer, and Dr. Sandeep Behu, pain and palliative cancer care specialist with Kite Senior Care, Bangalore. And special thanks to Dr. Purnima. She is unwell, her throat is aching, but she has obliged us and she is here to support us and be with us. A warm welcome to both of you.
Thank you.
Dr. Purnima will take us through certain facts about defining cancer, prevention, identification of certain early signs, and treatment of cancer specifically in the elderly. And Dr. Sandeep Behu will help us understand timely intervention and options for comfort care and pain management. Thank you so much for all of you to joining again. And to save time and for everybody's benefit, I think I'll quickly jump off. So how we will run the session is maybe I will ask a few questions to Dr. Purnima and Dr. Sandeep. We'll quickly wrap that up. And then we will leave the floor open for any of you to ask your questions. So we have done the basic chat over here. So Dr. Purnima, I hope you're feeling better and you have a hot cup of water next to you. We'll start simple. We will start simple and we'll go forward. So could you explain in simple terms, what is cancer?
Okay. First of all, a very good morning to everyone. I'm happy to have this opportunity to interact with you all. So basically, to understand what cancer is, we need to know like a body is made up of trillions of cells. So these cells are always in a dynamic state, right? They undergo multiplication, they divide, they repair themselves. But this is a very regulated process. There is no room for error here, and whatever error occurs in this process, the body fixes it. Sometimes what happens, there are some errors in the way the cells divide, some mutations occur, and the body is not able to overcome it. That is when the cells start growing uncontrollably. They just grow relentlessly, they form masses, they spread to other organs, they spread everywhere else. So this is basically what cancer is.
Great, thank you so much, Dr. So there are any cancers that we should be, I heard that there are two kinds of cancers, like malignant and benign. Would you explain this difference between the malignant cancers and the benign cancers?
Basically, the word cancer, what we use is restricted to the malignant one, the one which grows uncontrollably and spreads. Sometimes you may notice some lumps and bumps in your body, like a fat swelling in your arm or anywhere else in the body. These are called benign tumors. like suppose like a fibroid in your uterus, maybe a fibroadenoma in your breast, some lipoma in your hand or legs. So these are basically a benign tumor. They won't multiply and divide rapidly like a cancer cell does, and it won't spread also.
Okay. Would you throw some light on what is the precursor of development of cancer? How does it, how one body has cancer and the other does not?
Okay, that's a very good question. This is a question almost all of our patients ask in their OPD, like, why me? Why did I get cancer? What caused cancer? So basically, cancer, about 5 to 10% of them, they are inherited. These are called familial cancers. So this is something that you inherit from your parents, and there's nothing much we can do about it. So the majority of the cancers, around 90% of the cancers, are sporadic, as in these are spontaneously they develop over a lifespan. There are some risk factors, definitely, we know for sure, which contribute to this process. One is age, something again which is a non-modifiable risk factor. With aging, the process of repairing any mutation becomes weaker, so the cancer is able to grow in the body. Other things, 100% that we are sure of that contributes to cancer is smoking and any form of tobacco and alcohol. These are the two very definitive contributors to the formation of cancer. Then, of course, there are many other reasons. The infections like H. pylori, hepatitis, which can cause cancer, exposure to sun, even ultraviolet rays can also cause skin cancer.
Would you be able to tell us a few common types of malignancies that we find in the older people, in the elderly?
Yes. So the cancer which is most commonly found, mutual to both the genders, are that of lung, colorectal, that is your large intestine and the rectum, and stomach. These are very common and it occurs in both the genders. In females specifically, we have breast and uterine cancers. Breast is the most common cancer in women worldwide. In males specifically, prostate cancer is very commonly found in the aging population.
What would also help, I mean, because we deal with the elderly care, also help to spread awareness about to the elderly. What are the common signs and symptoms which they can keep an eye out for to initiate any action or intervention and recognize whether this particular symptom requires any attention? So be able to help us to identify certain signs or symptoms which the we can keep it in mind, the elders.
Yeah, definitely. So if you notice any lump in your body which wasn't there, especially if it's rapidly growing in size, that is a certain red flag. You need to get it checked. Apart from that, if you have any alteration in your bowel habits, like you develop diarrhea, there is mucus in your stools, or even constipation, it is a red flag for colonic cancers. Any bleeding from any of the orifices, blood in your urine, if there is blood in your stools, in post-menopausal women, if you develop bleeding, these can indicate that you could have a tumor underlying. One more important thing is jaundice. In elderly, jaundice indicates probably you could be having cancer of the liver or the pancreas. Also for stomach cancer, if you have gastritis symptoms, unfortunately for stomach cancer, in the early stages, they mimic gastritis. So if you have some kind of gastric like symptoms, some kind of indigestion, bloating, something which is not going away, you have taken treatment for say like 10 days, 15 days, it's not going away, then you should definitely get yourself checked.
From these single symptoms, is there any other allied symptoms which could indicate, that yes, this is the time for me to go in the way? Because gastritis or loose motions are something which we usually kind of neglect. So is there any other signs or symptoms that could be attributed or attached along with these primary symptoms?
Yes, of course. If you develop a sudden loss of weight, if you're losing weight, which is like unintentional, you didn't do anything and you've suddenly lost weight, you've lost appetite, you don't feel like eating, or you feel very tired, like when you have a low blood levels, anemic, you tend to feel very tired. You walk a few steps, you feel very tired, you feel your heart beating. So if you have these symptoms of anemia, or if you've lost weight, you're losing your appetite, these are definite red flags for cancer.
Really helps. Another very frequent question that pops up in our head is, can cancer be prevented?
With cancer prevention, I would say there are two things. One is the lifestyle. Something which everybody says, but not really many of us follow is, follow a healthy lifestyle, eat fresh food, avoid packed food, avoid salted food, eat fresh food, reduce your red meat intake, exercise. Because a healthy lifestyle will even prevent obesity, which in fact, obesity causes cancer. A few types of cancer are triggered by obesity. So a healthy lifestyle, avoiding addictions like tobacco in any form, smoking, regular exercise, eating fresh food will definitely help in preventing cancer. Another important aspect is it's not exactly prevention per se, but screening. Like if you screen for cancer when especially elderly age group, or if you have a definitive risk factor like someone in your family has cancer, then screening goes a very long way, because if you detect the cancer early, then you can be cured, and also the cure process will be faster and less painful.
Great. Okay. Will you be also able to give us little indications on the different kind of modalities, treatment modalities that are used for cancer treatment?
Yeah, so cancer treatment is usually a multimodal approach. So there are different techniques. First is surgery. A type of treatment is surgery, in which we physically cut out the cancer from your body and take it out. The second type of treatment is radiation, where we focus X-ray beams on the tumor cells to destroy them. And the third type is chemotherapy, where of course we use medicines, injections basically, and chemicals to destroy the tumor cells. So we use this in different permutation and combination depending on what organ it is and what stage we find it in.
Great. Thank you so much. I think that is a basic of cancer that you were absolutely pinpoint and to help us understand the condition. I will switch my gears and I will go to Dr. Sandeep. After, so when the treatment and all is done, there are times when it cannot be treated. So there, I think, comes in the importance of the pain and palliative medicine department. So Dr. Sandeep, over to you. Could you explain in brief what is palliative medicine?
Yeah. First of all, I'd like to thank Dr. Poonima for throwing light on the cancer on this World Cancer Day, because definitely the incidence of cancer is increasing, and then we need to create awareness. And I want to thank KITES for arranging this program. Yeah, thank you, Dr. Ima and Mr. Rajgopal. Yeah, coming to palliative care. So, what is palliative care? That is definitely the talk of the day in today's world, because palliative care is gaining a lot of importance. Because palliative care, it's an approach actually. It started as an approach that improves the quality of life in patients suffering from serious life-threatening illnesses. So, like cancer, we are talking of cancer today. So, when a person is diagnosed with cancer, okay, the person goes for treatment, and then there will be a time when all the treatment options are done, and the doctor says there is no more treatment.
Right.
So, what next? The patient asks, okay, what next? So, is it the end of treatment? But then that is when people are referred to palliative care. So basically the referral is for to decrease the pain mainly, and then decrease the symptoms the patients are undergoing, because the cancer is spreading continuously in their bodies. So to decrease the symptoms which occur because of these cancer cells and minimize their suffering. So that is the approach. So that is palliative care.
So basically, it's this team of people doing an approach to ensure good quality of life for the patients.
Yeah, so it is not just one specialist approach. So it's a teamwork. So the team is doctor, a trained doctor, palliative care, a trained nurse in palliative care. We have health aides who help assist in nursing care. We have pharmacists. We have psychosocial support care from a psychologist, a counselor. So it's a multi-team approach.
Yeah, okay, it's the holistic. And Dr. Sandeep, will you be also able to throw some light the difference between palliative care and hospice care?
Yeah, so palliative care and hospice care. Hospice care is a broader term. So hospice care, palliative care can be given in multiple places. It can start at home. So it can be given in nursing setups. It can be given in nursing homes. It can be given in hospitals, and then finally in hospices. So hospice care is where patient is admitted mainly for symptom management. So mainly after say a surgery, for rehabilitation, or just for respite care, when sometimes when an bedridden patient is there at home, and then families need a break because they have been taking care of them for a long time. They need a break, so that is when they admit in the hospice, and then the hospice team will take care of them for a couple of days. And then sometimes the families doesn't know how to give care at home, so the patients get admitted in the hospices, and they learn from the specialists, they learn from the trained team how to take care of these patients at home. So it's a broader term where patients are admitted, maybe after a surgery, even after their cancer therapy, say for example, after their chemotherapy. So a couple of days where they need special monitoring. So they can be admitted in hospices, taken care there, and then shifted back to the hospital or to their homes. So it's a general term, and definitely the care will be better because there is a specialist team there, like nurses, doctors, psychologists, counselors, everyone who is attending the patient. So patient care is much better in hospices.
So hospice, basically, we should not be scared of the term hospice because it just means ensuring good quality of life for the patient, not necessarily that we have lost the war kind of thing. Am I right?
Yeah. So I think you have brought the right word there. Now the improving the quality of life actually. So the aim of the hospice is improving the quality of life. Unlike in hospitals where the aim of the treatment is improving is the treatment.
Treatment. Yeah.
This is mainly the treatment. Here it is improving the quality of life. So care is there. So hospices, we keep the patient in the center and make the decisions. In hospitals, we keep the disease in the center and we decide, okay, what can be done for this disease.
What is the main focus? What is the objective of palliative medicine?
Like I said, it is mainly improving the quality of life. The approach helps to reduce the burden, the disease burden. So it can be a physical burden sometimes. So mainly the pain. So cancer patients, they go through a lot of pain. So it is a muscle pain, bone pain, nerve pain. So to reduce that pain, that can be done through pharmaceutical medicines, therapeutic medicines that are there. So that will reduce the pain. And then also there is a counseling that will reduce the emotional and the psychological pain. So the main objective of palliative care is to reduce the pain and suffering, and then improving the quality of life. That is the second part of palliative care, where the standard of living when patient is diagnosed with life-threatening illnesses comes down. So we in palliative care, we try to improve the quality of life. So by reducing the disease burden.
Yeah, and with the kind of numbers of cancer and other life-threatening conditions increasing, I think it becomes almost more eminent and important. Palliative medicine also gets more attention and focus, and people recognize that there is something available for them to reach out to that is not lost. Nobody lives permanently, but for however long a person lives, we focus on the quality, the emotional and the physical pain-free life is what palliative medicine is, what I understand.
Yeah. So quality of life, when we talk of quality of life, it is not just the physical aspect where the body is diseased. There is also a mental agony, a psychological pain. Sometimes they are isolated because there is a stigma attached to cancer. So when you see all this, there is financial burden. So
Yeah.
they spend a lot of money on the treatment. So overall, the quality of life decreases. So palliative care make efforts to improve that quality of life.
So there's also a very, very important question that comes to our head, and in our experience and practice that we have seen. What is the right time to opt for palliative care?
Yeah.
When should the family or a patient opt that, okay, this is the time that I should now approach a palliative care specialist?
So that's a very important question, Dr. Because we get references to our clinics only when the patient crosses stage 3 or stage 4.
Right.
Actually. But then that should not be done because patient has already gone through stage 1 and 2 and then already gone through a lot because of the disease process. So there is already quality of life that has decreased. So the best time for palliative care to start is at the diagnosis. So it is good when the patient, after seeing the oncologist, they are referred to the palliative physicians, so that the palliative physician team also knows about that patient and then develop a rapport, and then they are there right from the beginning and their diagnosis to help them cope up with the disease process as the disease progresses.
So initially it starts with emotional support and then gets on to emotional, psychological, and physical support.
Yeah. So sometimes actually most of the time, if you see the cancer, Dr. Punima said, okay, like stomach cancer, it starts with gastritis, right? So sometimes it is pain in somewhere in the body. So right from the beginning, it need not be just emotional, but then also from basic symptom management, like breathlessness. So things like that. So even those things can be tackled right from the beginning, the diagnosis. So that the overall the quality of disease throughout the disease process, it is improved and it stays.
So can palliative care be given in any environment? Like where can it be provided? Palliative care.
So palliative care, it's can be given actually in multiple ways. One is at home. Okay, so it can be given in hospitals by assigning a plain and palliative clinic and a couple of beds reserved for the palliative patients where there is no hope for any treatment. And then finally, it can be given in hospices and in centers like KITES here. So where there is a facility for the patients to come in, then get admitted and being taken care of by the specialist team. So and then after the symptom management is done, they can go back home, and the team also follows them by giving them home care services.
So it's like the team follows the patient in whichever setting the patient is, and just ensure that the patient is pain free, whether it is in their own homes or in the hospitals or in centers like KITES here.
Yeah. So palliative care, it focuses on the patient. So it involves a lot of follow-up. So the team follows them up, calls them regularly, asks them how are the things, how is the chemotherapy going, okay, what are the symptoms, so how can be tackled. Sometimes there will be differences between the patient and the family members because of the decisions involved in the treatment. So palliative team can help them in making those decisions. So like involving them in counseling, family counseling. So it is.
I think it was a very wonderful shot. I wanted to hear both of you out also for the benefit of people, but I am sure we have an audience who have tons of questions to ask both of you. So I will open the forum for anybody to ask questions. Please unmute yourself. You can either type the questions in the chat box. I also see a lot of questions coming up, which I will take it up. Maybe I'll start with the chat first, and then we'll unmute and go forward.
Rima, would you want me to read the questions for you?
Yeah, I just opened it up. So, Shubha Sagaram is asking, apart from the common methods of treatment like chemo, radiation, surgery, is there any other alternative treatment for cancer? Would Dr. Purnima would like to take it? I think it has to be unmuted.
So apart from the standard three methods that I spoke about, there's something called immunotherapy which is coming up. Basically, we'll do a mutation analysis of your cancer, and if there is any actable target on it, we can administer immunotherapy. This is coming up. Apart from that, there are experimental treatments, none of which are proven. So cancer is like an ever evolving field. A lot of research goes in, a lot of effort goes into find treatment. But as of now, chemo, radiation, surgery, and immunotherapy are proven to be effective.
Right. There's another interesting question that we have from Mr. Ravindra. Does chest X-ray cause cancer?
Yeah, so chest X-ray has very low dose of radiation. This dose is not carcinogenic, so yeah, no, it will not cause cancer.
By another question by Lakshmi Bhattacharya. How many kinds of cancer are there, and how often should you get screened for it?
It's a very good practical question. Basically, there are many types of cancer, like many, but the common ones are the ones which we should look out for, like the breast, prostate, colorectal. So we would suggest a mammogram from the age of 45, which is an yearly mammogram. Mammogram radiation is again a low dose; it's not going to cause cancer. Colonoscopy will screen for colorectal cancers. We are starting at the age of 45. It needs to be done only once in 10 years if your initial colonoscopy is normal. And then for the uterine cancers, we recommend a pap smear starting at the age of 30, once in every 3 years. If you do HPV, the human papillomavirus analysis, the frequency can be reduced to once in 5 years. For men, we will recommend screening with the PSA, prostate-specific antigen. It's basically a blood test which will go up in case you have prostate cancer.
I think that also answers with mammogram screening every year will cause cancer. I think Dr. Purnima has answered that it will not. How important is second opinion in cancer management? Mr. Krishnan from Chennai has asked.
I would say there is no harm. Definitely, you could take a second opinion because it varies. The perspective of doctors also vary. Probably taking two opinions and then taking an informed decision would be a good way to go about it.
Another interesting question. How many chest X-rays are safe during a lifetime?
Okay. Fine. I really don't have an exact number to give you, but then most of us would not need like a regular chest X-ray. So once in a while, definitely will not harm. Basically, a chest X-ray, even the Earth has basic radiation. You know, the Earth also emits radiation. So what we are exposed to day, maybe 10 to 15 days of worth is one chest X-ray. So it's really not that harmful.
There's one more question. Does burnt food cause cancer?
I'm sure we don't eat burnt food, but once in a while it's not going to harm. Definitely preserved food and salted food. These definitely cause cancer, and red meat is known to cause colorectal cancer.
All right. Would you answer this other question? What are the different stages of prostate cancer and what symptoms we can see?
So basically all the tumors are staged according to if they're confined to the primary organ or it's spread elsewhere. Almost all the cancers are staged into 4, with 4 being the one where it is spread to other organs. So basically prostate enlargement in elderly males will lead to difficulty in voiding urine. They'll have to strain, the stream of urine will be thinned out. They may have some chronic nagging pain in the pelvis. The night time, they might have to get up and void urine multiple times. Again, these are very similar to your benign enlargement of the prostate. After 50 years of age, your prostate does increase in size. It's a physiological thing. So screening with PSA would be a good way to go about it.
So while we are at it, Dr. Purnima, would you also help us to understand in what way site care, researchers and the kind of technology that SiteCare has to offer in treatment of cancers?
Yeah. So SiteCare follows all the international guidelines. We follow a tumor board approach. Basically, all of us, the surgeons, the chemotherapy doctors, that is a medical oncologist, then the radiation doctor, that is a radiation oncologist, along with the pathology and the radiology, all of us sit together, and then we chart out a detailed plan. Like we confirm the stage, then we decide what is the best way to go. So in cancer, 2 + 2 = 4. That is never the scenario. Everything depends from patient to patient basis. So we all sit together and discuss like what all treatment options are feasible, in what order should we go about it, and what are the possible outcomes. So this is the way we go about it. Also, our hospital does do clinical trials with the medical oncology team. So if there are some trials going on in the world, experimental trials, newer treatment, so there are some trials here in which you can get enrolled for better treatment.
There's one question which I think I will take. Are residential palliative care expenses covered by insurance? Very good. I think if a hospital is handled under an insurance company, then it is fully covered till the time your sum insured gets exhausted. If you opt to be in at home, a part of it is also covered, because as it again depends upon the terms and conditions of the policy that you have bought, because some insurance policies do cover a part of the home care expenses. Specifically hospice centers where people get admitted are concerned, it is yet opening up to the insurance, and in case they have some insured left in their insurance and their insurance terms and conditions allows the post-hospitalization expenses where therapies, medicines, lab, etc. can be covered. So part of the expenses definitely can be covered by the insurance company. There's one more question. What type of sun rays exposure is harmful, whether morning, afternoon, or evening?
It's always the peak, like in the afternoon, I would say. The early morning rays and the sunset rays are probably not that harmful. The peak hot sun rays are the ones which could be harmful for you.
Where the UV rays strengths are the maximum spend.
Yeah.
Very interesting question again. I think it is also nowadays we are seeing occurrence of happening. Why is the reason a person gets second time cancer? I'm not sure whether this question is asking the recurrence of the same limited cancer or it is a new kind of cancer, but we are seeing two cancers coming up in the same patient nowadays.
To answer both, the first thing about recurrence, basically any cancer can recur. So after any treatment, we do a close monitoring of the patient for about 5 years. They usually tend to recur in the first 5 years. So yeah, definitely any cancer and surprisingly any stage can recur. Strict surveillance is very important. If you get a second cancer, it could be there are some underlying inciting events, maybe exposure to tobacco, a genetic mutation. There are some genetic mutations which cause syndrome of cancer, like you could develop bowel cancer, uterine cancer, breast cancer, all in the same patient. It's because your genes are mutated and defective.
Right. I think I will give rest of a couple of minutes to Dr. Purnima and I'll Dr. Sandeep. Dr. Sandeep, you have seen so many questions coming up right now. How do you think a palliative care intervention, if we take a patient with, for example, a prostate cancer in stage 2, the diagnostic, how can palliative care help them and how?
Yeah, so in palliative, as we focus mainly on the quality of life, right? So mainly after the treatment, sometimes when the patient is sick, so if you see this prostate cancer, the metastasis to the bone is is seen in a lot of patients. So they have a lot of bone pain, palliative. So patient can be helped with palliative by administering pain medicines So there are medicines that will relieve the pain for them. And then after the chemotherapy, when the immunity is low and the patient feels sick, nausea, vomiting, that can be managed by palliative specialists.
There is one more very difficult question or a scenario that families and the patients face: accessibility to the pain relief medications. You know, how easy it is to procure, how easy it is to get access to them, how do they ensure that there is a regular supply? Would you be able to put some light on that?
Yeah, so one main challenge for palliative patients, like you said, is accessibility to certain medicines, not all medicines. There are a different class of medicines palliative care team uses for pain relief. So there are class 1 which are readily available. So just any doctor can prescribe and then can get it, like simple medicines like paracetamol, diclofenac sodium, all those things are readily available. But there are certain class of medicines, we call them narcotic drugs for therapeutic use. So they are really licensed medicines. So only certain centers who have this license to store it and to dispense it to the patients. So we need a separate license for that. So if that center has, then they can store, they can dispense. Only thing is they need a proper prescription from the doctor. So like pain and palliative doctor, any doctor, their registration number. The doctor's registration number is important to have that, and then patient's address. So that is very important for the person who dispenses the medicine for the record, because these records regularly they have to be reported back to the government. We have to send the report back to them, so to get the next stock of medicines. So currently Bangalore has good amount of drug storage in a couple of centers. I think even Kites is also working on that, I believe, in future. Yeah, so I think so in Bangalore, I don't think it will be difficult for anyone to get these medicines. But outside Bangalore, in different districts, I think it will be a challenge still, because there will be only very few centers who will have this.
I think Mr. Muralidharan has asked one question. I think we will answer that separately. I'm not sure I have the answer up front right now. Anyone of us could be. He's trying to procure a drug. We will get back to you, sir. Whatever help we can extend to you, will definitely. Yeah, if anybody wants to ask a question, kindly please unmute and you can ask a question. Right, yes, this is one question. For Dr. Purnima, Mr. John has asked this question. Can constipation be a symptom of a cancer? If so, which organ of the body?
Yeah, so constipation, if it is new onset, like you had regular bowel movements and you suddenly develop constipation, it could indicate the cancer of the colon or rectum, basically your large intestine. So you should get yourself checked if you have a new onset constipation.
So this is a very tricky question as far as elderly are concerned, because constipation as a symptom is pretty common in the elderly. So what is along with constipation that again they should keep it in mind that, okay, should I get worried, should I get panicky, when is it that I should go to for check, and after how many days of non-treatment of constipation, something like, can you throw that?
Yeah. So basically, like I already mentioned, in elderly, we would highly recommend you get a colonoscopy done. Basically, colorectal cancers are slowly growing tumors. So if your initial colonoscopy is normal, you need to repeat it only once in 10 years. So that is the most important thing I'd like to stress on. And besides that, along with constipation, if you have difficulty in straining, you need to strain, or there is your stool is mixed with blood or mucus, you don't feel like eating, you've lost your appetite, you're losing weight. These are the red flags you need to address if you have developed constipation. And basically, the thing with constipation due to tumors is it's a mechanical block. So the tumor is growing and blocking your large intestine. So laxatives usually may help, may or may not help. Usually it will not help. Even if it helps, it's going to come back, it's going to get worse. So yeah, that's the thing about it.
So there's one more thing probably all elders to understand, that getting screening or getting tested for any treatment which is not getting sorted is not to get panicky, but to rule out the presence of any condition rather than going and confirming that yes, I have it. I think that's a positive way of looking at it. Yes.
Yeah. Many times, our patients did have symptoms for several months before they come to us. So please don't be scared of medical tests or doctors or hospitals. The thing is, like, if we detect cancers early, we pick them at the early stage, you can get away with one modality, like early colon cancer, only surgery may be enough. You need not even undergo chemotherapy. So your recovery is so much better. It's so much easier, so much less painful. The duration, cost, everything comes down. So early detection is gold when it comes to treatment of cancer.
There's one more question. Mama has written that many of us have issues with gas. Is there something to be concerned about?
Yeah, so if you have this vague discomfort, gas up there, like indigestion, you're feeling uncomfortable, you're obviously, all of us know what Pantop is. We will take the medication. You take it for like 2 weeks, 3 weeks, it's not coming down, then please come to us and get yourself checked, because something discomfort lasting for a very long time and it's not getting better with over-the-counter or symptomatic medicines, then you should get yourself checked.
And probably maybe increasing fiber in the diet or physical activity may also relieve it.
Yeah, constipation per se, like I said, exercise, healthy diet will improve your bowel health as well.
There's one more question that has come from Mr. Ravindra is, do whole blood stool examination helpful for diagnosis of CA?
It will actually, if it comes as positive, it is more of a positive value. If you do a stool occult blood examination comes as positive, it is definitely helpful. But if it comes out as negative, we cannot really say that you do not have cancer, because at that point of time, the tumor may not be, bleeding or showing up in the test. So the more definitive screening for colonic cancer would be a colonoscopy.
Again, I'll give you some rest. Dr. Sandeep, how do you think the awareness of pain and palliative medicine is with the masses right now?
Sorry, I didn't hear.
So how do you, this palliative, is it a very common thing for the people? Are the people aware that there is an option called as palliative medicine available for them to reach out to? How is the awareness in the common masses?
Yeah. So palliative awareness is, like I said, it is still in the budding stage. It's in the baby stage. So awareness is certainly still very less. So even among medical professionals, they just have come to know that there is a specialty called palliative care now. But then, over the last, it has been there for the last actually 60 years in the globe, and it has reached 30 years back in India. But then still no one is talking about it yet. But then with increasing cancer incidences among the society, the palliative awareness is slowly increasing. One more thing about palliative care is there's a lot of stigma attached to palliative care, because people think, okay, once patients are referred to palliative care, that is the end. So there is no going back, but that is certainly not true, because that is not the end of care. So in palliative care, we continue the care for the patients, and then we try to reverse whatever can be reversed even during those disease processes. Say, for example, if patient are down with low sodiums. So in palliative care, it's not like we don't treat those conditions, we definitely treat. So we try to reverse whatever can be reversed. Certainly cancer, when it goes beyond certain stage, there is no reversal of that. But then symptoms definitely can be addressed in palliative care. So the general awareness is less. So we need to, people have to still need to get aware of the specialty, and or programs have to be done.
Great, thank you so much. Any more questions from anyone? You can type it in, please. Great. I think what we'll do is, so we have displayed our phone numbers, the email ID, where you can reach out for any query on any cancer symptoms, early signs, screening, etc. We will pass it on to Psychiatric Hospital and Dr. Purnima's team. And for any pain and palliative requirement, you can reach out to KITES. We will organize that too. So today, what we have tried to do is basically just brush on the surface of a huge issue that we are all facing. There's a lot to learn and act in the right manner for prevention, early detection, treatment, and most importantly, in the elderly age group, comfort care where the patients are suffering from cancer. So I take this opportunity, I profusely thank Dr. Purnima, who has agreed to be part of this chat in spite of her immensely busy schedule and her health not been okay, and Psychiatric Hospitals for partnering with us for this program. Dr. Sandeep, who's a part of us, is a pain and palliative specialist for the important insights attached to the care of this disease, and also helping us to spread the awareness of this particular branch of medicine, which is very, very important to enhance the quality of life for everyone. I thank you, all the participants. Thank you for making this in coming on to this forum and attending this thing. I hope this was of use. Maybe we have answered lots of your questions and lots are still remaining unanswered. Please feel free to call us anytime. Please feel to write to us anytime.